child health nursing subject we are going to discuss. Okay, in that one chapter, that is the 6th unit. Okay, chapter name is the children with various disorders and diseases. Okay, regarding this, in this video we are going to discuss. Okay, before going to entering into the topic, first of all we should learn about anatomical structure or the anatomical parts of the human body. Okay, in that anatomical structure or anatomical parts of the human body, in that so many organs is there in the human body. Okay, in that organs like for example GI system is there. Okay, gastrointestinal system. In that system, what organs is there means mouth, esophagus, okay, stomach, intestines, in that small intestine, large intestine, okay, like that organs is there. Okay, another system like respiratory system. In that respiratory system, what organs is there? What means lungs is there. Okay, major organs. In that urinary system is there. Okay, in that urinary system, what organs is main important for functioning of urinary system means in that major organs like kidneys. Okay, every human being has 2 kidneys, 2 ureters, 1 bladder, 1 urethra. Okay, these organs is very important in that urinary system. Okay, what is the function of urinary system? Why the human being having this type of urinary system means, okay, in the urinary system, this kidney, ureters, urinary bladder, urethra, all organs major working for the function of what means regulation of water and purification of blood. Sometimes what organs or what type of soluble ingredients will be remaining is there means that will be reabsorption. Okay, in that kidney. Okay, in this kidney one major parts is there, that is the small main important one, that is the nephron. Okay, what is the use of nephron? Why the human being having this type of nephron means nephron is one type of structural and functional unit of the kidney. Okay, every kidney having many types of many cells of the this nephrons is there. Okay, why we are discussed regarding this means in this disease condition we are going to discuss about nephrotic syndrome. Okay, nephrotic syndrome part 1 we are going to discuss. Okay, nephrotic syndrome part 1 we are going to discuss. Nephrotic means nephron. Okay, nephron is there. Nephron is there in the kidneys. Okay, what is the function of nephron means? Nephron is a structural and functional unit of the kidney. In the kidneys, every kidney having many cells of nephrons. Okay, in the presence of nephrons only the kidney will be work. Okay, along with syndrome means a group of symptoms. Okay, group of symptoms we are called as the syndrome. Okay, in this nephrotic syndrome what happens means normal structure of the nephron having some type of abnormalities, means their function failure or structure failure. Okay, during that many symptoms we are identified. Okay, that's why this condition we are called as the nephrotic syndrome. Okay, in this nephrotic syndrome also called as the one term, that is the nephrosis. Okay, nephrosis also called as the nephrotic syndrome. Nephrotic syndrome another name nephrosis. Okay, what is mean by nephrosis or the what is mean by nephrotic syndrome means the nephrotic syndrome is not a single disease condition or one symptom. Okay, in this nephrotic syndrome group of symptoms is there. Okay, group of means many symptoms is there. Okay, in that group of symptoms mainly especially 4 symptoms we are identified. Okay, mainly the child will be suffering with the or the child showing mainly 4 types of symptoms. Okay, what are the symptoms means the symptoms like first one is the edema formation. Okay, retention of fluid in the body, that's why the edema will be formed on the kidneys or body. Okay, this is the first symptom, that is the edema formation in the body organs. Okay, second symptom like hypoalbuminemia. Okay, hypoalbuminemia means less or decreased albumin levels in the blood. Okay, in the blood compulsory having some albumins. Okay, who are suffering with this condition of nephrotic syndrome? Those children are having the one problem like decreased albumin levels in the blood. Okay, this is the second symptom. In the third symptom, that is the proteinuria. Okay, the child will be excreted urine. Okay, in that urine continuously excretion of urine. Okay, in that urine protein loss is there. Okay, in that normally proteins are not lost, but who are suffering with this disease condition of nephrotic syndrome, those children are showing one symptom like protein loss in their urine. Once they are excreted urine means in that particular urine, when we are testing means in that protein percentage will be increased. Okay, next another one is the last symptom, that is the hyperlipidemia. Okay, hyperlipidemia nothing but when we will test or when we are observed of your children in that particular children showing one symptom like albumin lipids, nothing but cholesterol levels will be increased in the blood. Okay, first symptom albumin levels decreased in the blood. Okay, last symptom, that is the cholesterol levels increased in the blood. Okay, another one is the proteinuria, protein loss in the urine. Next edema formation in the body. Okay, these four major symptoms is identified in the children. Then we decide the child will be suffering with the one disease condition, that is the nephrotic syndrome. Okay, this is the definition of nephrotic syndrome. Next we go for the classification. Okay, in this nephrotic syndrome mainly two types is there. Okay, what are the types means? First one is the primary, second one is the secondary. Okay, primary nephrotic syndrome, secondary nephrotic syndrome. Primary nephrotic syndrome, how the child will be suffering means primary nephrotic syndrome will attack by birth. Okay, by birth means congenital. Okay, along with mother womb. Why means the pregnant lady or antenatal mother, okay, in their pregnancy period, once she affected by this disease condition of nephrotic syndrome, the disease may be spread through the umbilical cord to the fetus. Why? Because in that pregnant lady complete proteins, nutrients, blood circulation will be transferred from the maternal to children's, mother to child. Okay, through the umbilical cord. That's why the disease will be spreading easily to from the mother to children. Okay, that is the congenital, by birth. Okay, by birth the child having the nephrotic syndrome disease condition. Okay, that we are called as the primary nephrotic syndrome. Okay, another one is the secondary nephrotic syndrome. It will be caused by some type of acquired disease condition, means poor personal hygiene, or the child not maintain good immunity power, or in their systemic infections. Okay, in the body any system having any infection means the infection will be maybe spreading. Metastasis means one part to another part, another part to another part, the infection may be easily spreading. Okay, or sometimes the child not taking good nutrition means due to the nutritious loss, the child may be suffering with this type of may be prone to get this nephrotic syndrome. Okay, these are the classification. First one is the primary, secondary. Okay, primary will caused by the congenital, by birth. Okay, secondary will be caused by the acquired causes or acquired infections. Okay, any infection will be there, means in the body any alterations or any deficiency or any diseases is there in the body parts, means the disease may be spread to the one part to another part. Okay, this is regarding classification of nephrotic syndrome. Okay, next we are going to discuss about etiological factors for the nephrotic syndrome. Okay, in these etiological factors mainly some is there, that is the nephropathy. Okay, who are suffering with the one type of nephropathy symptom that may be affected to the nephrotic syndrome. Okay, another etiological factors like glomerular sclerosis. Okay, glomerular is a one part that will be there in the kidneys. Okay, what is the use of glomerular means? It is also used for the, or it is also helpful for the purification of blood, for excretion of wastage. Okay, any problem is there or any fat accumulation is there in the glomerular, this layer may be not functioning well. Okay, next another one is the streptococcal nephritis. Okay, due to the streptococcus means it is a one type of bacteria, no? Okay, due to these microorganisms, nephrons getting some type of infection. Okay, due to the nephritis, the child may be prone to get infection of nephrotic syndrome. Okay, another one is the immunity changes. Okay, in the body, the child not having a proper immunity level means, why means the immunity will be low means due to less immunity power, the child may be prone to get this type of nephrotic syndrome. Why? Because what happens in the immunity, what is meant by immunity means, in the immunity means in the body, okay, blood having the some type of immunity cells. What are the immunity cells means? In the WBCs, okay, T lymphocytes, B lymphocytes is there. Okay, in the T lymphocytes, B lymphocytes is there antibodies, they are fight against the antigens. Antigens nothing but microorganisms. Which microorganism will be enters into the human body? Immediately from the body, the antibodies will be released. The antibodies will be fight against the antigens. Okay, if the number of antibodies will be there means antigens may be killed. Okay, in this resulting immunity power increased, the child not getting any infection. Sometimes the antigens number will be increased, the antibiotics their less number is there, they are not well participate in the fighting. Okay, due to that the child may be shows symptoms like edema formation, hyperlipidemia or hypoalbuminemia or proteinuria. Okay, these symptoms may be showing by doing this type of process. Okay, these are the reasons for the nephrotic syndrome. Okay, another one is the thrombosis. Okay, in that thrombus formation means in the kidneys, okay, urinary bladder or ureters or nephrons or glomerular, any part, thrombus formation, fat accumulation will be there, the normal function will be altered. Okay, due to these reasons the fluid may be retention, purification may be decreased or altered purification of blood. Okay, due to these reasons. Another one is the congenital heart failure. Sometimes the child may be suffering with the heart diseases. What is the relationship between the congenital heart failure and nephrotic syndrome means? In this nephrotic syndrome also one problem is there now. In the blood albumin levels decreased, or sometimes in the blood cholesterol levels may be increased. Okay, due to these reasons the heart may be failure their functioning of normal. What is the functioning of a heart means? Heart will be circulate the blood to the all over the body parts. Okay, in that time what happens means the blood is not purified or the blood not supplied to the all body parts means the child may be suffering with this condition of nephrotic syndrome. Another one is the leukemia. Okay, in this leukemia what happens means it may be cancer of WBC cells. Okay, white blood cells cancer. In this what happens means one relationship is there now, WBC will be active or healthy means the infections are not spreading to the body. Sometimes WBC is very weak, means low number of their leukocyte count, means the child may be prone to get some disease condition. Okay, due to this the child may be suffering with the nephrotic syndrome. Okay, these are the etiological factors. Okay, thank you everyone.